Moving on to our next speaker, we have with us Dr. Thomas Rao. He's a renowned pioneer in Swiss biological medicine, known for integrating natural therapies with conventional medicine to transform global cancer care. His journey into holistic healing was shaped by observing the limitations of conventional treatments and a personal drive to empower patients with root cause solutions. Here he is with us to share revolutionary approach to holistic cancer care. His topic for today is Swiss biological medicine, casual diagnostics, and multimodular biological cancer treatment. A very warm welcome, Dr. Thomas.
Yes, I hear you. 1 second. Do you see my PowerPoint presentation?
No, can you please share it again?
Du hast jetzt sehr viel PowerPoint. Was? Aufmachen normal, das Präsentationsmodus hat?
Okay, oops, now I can do it.
Or do you want me to share the
Okay,
presentation?
no. Did it come up now?
Not yet. I will share the presentation for you. Just give me a minute. Dr. Thomas, can you see my screen?
No, I cannot see.
I have shared it for you.
Okay, now. Yes.
Yeah, you can start your presentation. You can start talking.
Can you make it bigger here? So.
I did that. Can you see it?
Yes, but how can I switch now the slide?
I'll do it for you. Please let me know when you want to go to the next slide.
Oh, this is absolutely not good. Could we not try again, because this is really not good? I have.
Ja, dann du auf dem Flieger, bei dir im Zoom.
Freigeben.
Genau, freigeben und dann tust du auf den Bildschirm klicken, wo freigeben willst.
Dr. Thomas, you can try sharing your screen again. I'll stop sharing from my end. If you can just go to the share, yes.
Okay, now it would work, yes. Now
yes.
It's good.
It's good.
Okay, super.
1 second, I try now. So.
It's good, yeah.
Now it finally works. Thank you very much.
Okay.
Okay, thank you.
Bis zum 10.
Ja, ist gut, ich gehe noch zwischen deinen heim. Ja.
Tschüss.
Ciao, ciao. So finally it works. I'm sorry about this, and so I would begin my presentation. Do you have my slides on your screen?
Yes, we do.
Okay. And it switches now?
Yes.
Okay, good. I'm sorry about this technical problem. I'm really not a computer guy. I'm a 100% practitioner. I thank you very much for asking me to present this important PowerPoint, because we do in our clinic in Switzerland, we do cancer treatment since more than 30 years, and I just wanted to show to you how we have the strategy for multimodular biological cancer treatment, how we do this, and how logical the biomedicine cancer treatment is, and how effective especially it is. So that's my name. My name is Dr. Thomas Rao, and I'm coming from Switzerland, and we do, as I said, we had quite a big clinic, which now we had another clinic, which is more specialized for treating different kind of diseases, mainly cancer, but also unclear disease, post-COVID explodes, so to say, post-vaccine problems, they explode in a way. So we get more and more of these kind of patients. So this is one thing. Then you see here my address. If you have questions, please go to this WhatsApp, to this email, or to this web page. It is biomed-int, like international.com. This is our web page, which explains about the seminars, the education, and the congresses where I take part. Very luckily, I'm also invited to go to the big congress, which will be taken in Bali in 26th of February, or on this weekend. And biohacking, they call it biohacking, medicine for biological medicine, where I will talk more in depth about dark field, our diagnostic tools, and so on in Bali. But I believe that the organizers are Indians. So here you see our clinic. This is in Switzerland. We have snow now. It's already winter here. And this is the hotel part of the clinic. We have a hotel, we have a vegan restaurant, and we have all these biological treatments which we can do here. And as I said already, our team of 45 persons, nurses, therapists, 4 doctors, a dentist who works with us very closely, because you need the dental approach also very much. And I am sitting here on the top roof in my office. So this is, well, it sounds arrogant when I say we are probably the most experienced cancer treatment center, because I do this since 30 years. And I have many patients, even, well, from India, we have from Malaysia, we have from everywhere in the world. And so you also see the hotel, Biomed-Sonnenberg. Sonnenberg is like sun, mountain, Sonnenberg is mountain. So we are really on the top of the hill, and we have a impressive view out of these balconies to the whole Swiss mountain chain. We are very close to the mountains, and it's really impressive. So this atmosphere is even very much healing. But we will talk now about the cancer. So we have paradigms to understand cancer, and these paradigms are very important. Cancer is a metabolic disease. Well, this sounds clear, but it is not mentioned anywhere. So, and cancer is always has a toxic background. This is so extremely important. That's why when we get the cancer patients to my treatment, it is aroundish 500 new cancer patients per year who come to us. For sure, it's around 400 to 500 cancer patients who come new to our clinic. So it's really a huge turnover. And we have daily and we have yearly aroundish 1,000 to 1,200 new patients anyway who comes to the clinic now. And 80% of these patients, of the international patients who come to us, who need an international flight, intercontinental flight, they come back. We have a returning rate of more than 80% in our patients, even the intercontinental patients, who are aroundish half of our patients. Nobody does this treatment, and it's so extremely important. Cancer is an intestinal disease. I know this sounds super crazy when I say so, but there is a background behind this thinking that we are a intestinal. When we look at our cancer patients, when they come to us, whatever stage they have, whatever cancer they have, we test them for intestinal problems. We make a comprehensive stool analysis. We measure zonulin, we measure the secretorial IgA, we measure the calprotectin, and I can nearly guarantee that these patients, cancer patients, they have a absolutely horrible intestinal situation. They are especially lacking of Bacteroides bacteria, which should be the most important and most frequent, most numerous bacteria in our body, but they are not present. It is really extremely problematic. And they would provide the stimulation of the T cells. So why do I say we have a cancer speech and I talk about the small intestine? This sounds super crazy, but please believe me, it has an important relation to cancer in any way, because the Peyer's patches which are the carrier of the 90% of your T cells and the lymph cells and the NK, natural killer cells, they are laying in the wall of the small intestine. It's about the small intestine, the biggest organ of the body. So these Peyer's patches, they are in every cancer patient. We tested more than 1,000. They are insufficient. Who wonders then that these patients, they have a decrease of their own immunitary approach to the cancer. So you always have to add the treatment for the intestines. You always have to test and to upbuild. We do, when the patient comes, we do a NK cell, natural killer cell activity test, and our cancer patients, not even measuring if they already do a orthodox treatment, which is not bad. I'm not against chemotherapy, but I'm against only doing chemotherapy. You have the much, much, much better results, and I'm really experienced in this, when you add biological approach and upbuilding treatment and detoxification treatment to your cancer treatment. Never do chemo or radiation or operation, all these orthodox approaches. Never do this without a strong biological approach and addition to the treatment. So I would even say our patients, our treatment, my cancer treatment, and we really have extremely good results. My cancer treatment is primarily a metabolic treatment, a dietary treatment, a treatment for the intestinal immune system, and secondarily, in addition, we do orthodox medicine. So chemo should be only additional to what we do. So we are not the complementary medicine, we are the primary medicine, and complementary to us would be, I know very well in which case, what kind of chemotherapy, how long are they needing a monoclonal antibodies and all these kind of things. Cancer can be significantly changed with diet. There are so many. Former times it would be mainly in Europe, but now there are also in the US, there are dietary clinics which add cancer. There are even two, I don't name them, in the United States, in Florida, who do more or less only with diet, but strict, the cancer treatment. For me, this is not enough, but what I learned there, I'm consulting with this clinic, is the biggest one. I'm regularly consulting, but what is important and interesting, that they even with doing a strict diet, they have quite good reoccurrence rates. So you do need to tell your patients how to change the diet. And in our hotel, we are the only, in Switzerland, we are the only acknowledged four-star. Four-star is like five-star in India. So four-star hotel, vegan, fully vegan, gluten-free and sugar-free hotel. And you have to come here. And then you can see how we do the buffet every day, how you get the 4-course menu. And it's fantastic food. And we tell the patients how to learn to do a simple so-called cancer diet, which is low in gluten, which is free of cow dairy protein, and which is free of sugar. No sugar allowed, because cancer cells, they need sugar. Now, only cancer cells are only treating cancer never leads to success. That's why it's so important what I said. Well, we have these 3 pillars. It sounds a little bit strange, but how do we approach cancer? We approach the human being. I always tell my patients, we do not treat histology. We do not treat MRI findings. We not even treat genetic findings. We treat you as a full, entire individual person. And nobody fits in guidelines, because guidelines, they base on histologies and on stages, but they do not consider the constitutional quality and the surrounding quality of the body. And cancer is caused by toxic load. Cancer is caused by a decrease of immune system. And then these patients come, this is pillar number 3 on the right side. The patients, they come, they are so weak from cancer, they are on cachexia, they come, or they have had chemotherapy, they are super weak, and then nobody builds them up. So what we do is in addition to the whole treatment, immune upbuild, detoxification, we build up the patients cell by cell, because the patients, they are by the cancer treatment, by the chemotherapies, by the radiations, they are extremely weakened. And most of the symptoms they have comes from cachexia and not directly from the cancer. Our cancer patients, it's amazing, even if they have bone metastases, even if they have stage 4, we have many stage 4 patients. And even then, within several days, by alkalinizing, by changing the metabolic situation, by giving them the vitamin C and other infusions, which are alkaline infusions with sodium bicarbonate. We infuse sodium bicarbonate, and nearly over days, pain goes away. So we do not need morphines in our clinic. We can even reduce if they come with morphines, because any kind of morphine against pain makes the regulation and the healing capacity of the body much worse. So we need to do immune support. We need to look for the causes. And when I did on more than 1,000 patients, we really tested day 1 they came. Some came without any other treatment, but most came after many kind of treatments, repetitive chemos, repetitive operations. And then they come and we look for the teeth, toxic loads, foci, disturbance fields. We look for heavy metals. We look for organic agricultural toxins, which are highly, highly cancerogenic, and they are showing extremely high toxic load. So we detoxify and we release the immune system from this load. And so the body begins to produce its own immune approach to the cancer again. And this is why we have these extremely good long-term results, especially on breast cancer, any stage, but also on colon cancer and on malignant melanoma, even metastasized through the body. We have very, very good. They respond especially well. And also malignant lymphomas, not only skin cancer, but also lymphoma. Biomedicine cancer treatment can be done at the same time in parallel to orthodox treatment, never done alone chemotherapy, I told you already. And our cancer treatment is a lot of teaching the patients, and because it's a long-term program. My patients, they stay, of course, not personally, but in contact. They should stay over long-term in our treatment. But you send the patients to me. We do this intensive beginning work. Normally the patients stay 1, 2, or ideally would be 3 weeks, but most stay 2 weeks. They get taught what kind of diet, what they have to do, what is their individual supplementation, and we begin all these treatments, for example, the mistletoe treatments, and we teach them, and also we look for another doctor, or they come back to you and they have a clear schedule what they should be done. So they come in a very bad situation normally, and we build them up, and within 3 weeks their body is extremely much stronger, and so they are on another level, and we continue together with you, the patient, the doctors who send the patients to us. We do a partnership, so to say, well, a collegial partnership, which allows the patient to be with you in our treatment, and we give them an initial medication, which they, according to what you say afterwards, the referring doctor, what you say, what you can do. Cancer operation should be never done without intensive biological preparation and post-treatment. There are studies by this Professor Schweitzer in San Diego, California, who just did several hundred patients, breast cancer patients, with a preventative or a preparing selenium, vitamin C, and zinc treatment, mainly selenium and vitamin C, before they did the operation, and at least 1 week, and afterwards for about 1 month. And they had a group without, which just went, oh, you have cancer, you have to operate. You go to operate, they do the lumpectomy or they do the mastectomy, and no preparation, no post-treatment. And the prognosis, the outcome was extremely much worse in the patients who did not have a pre and a post-treatment. So cancer operation should be never done without intensive biological preparation and post-treatment. Sorry. I show you a case. Case number 1, a cancer patient. This cancer patient was treated in the US. She had operation, chemotherapy, radiation. It came back. She had again operation and chemotherapy. Then it metastasized. She came afterwards, after several chemos and several operations, she came RIP metastases, lumbar 5 metastases, lung metastases, and this situation to the left. What did we do? She came, well, this is an exceptional case, of course, she came again and again. In the beginning, 3 weeks, and afterwards she came in the beginning, you can hardly believe, from the United States. Every 4 to 6 weeks, she came for 4 to 6 days. And we did every day most intensive treatment. I tell you what we did. And now, and this was a process which lasted several years. She was in the Anderson Cancer Center, and she was in other cancer clinics also. So she wasn't a patient who just did nothing. No, absolutely not. She was fully treated. She was stage 4B with heavy symptoms. Most important for her, the symptoms, the pain went, even though she had metastases in the bone, in the rib, and in L5, which normally makes a lot of pain. She did not have pain anymore. What we do is injection into the tumor around. We give after the injection, which of course is adding lidocaine or procaine. We do, when it's anesthetized locally, we do ozone treatment, and we do hypothermia, we do ionization, which is PAP, IMI, PAP-IMI. Go to internet, PAP, to the website, papimi.com. You will be amazed. This device is absolutely magic in reducing the metabolic activity of cancer cells. It increases the cell membrane potential. And we do this, that's why we do a very intensive treatment in our clinic when they come. 1 week, 2 weeks, ideally would be 3 weeks, because the lymphatic system needs a 3 weeks rebuilding time. And then look how it looks now. She is with us. And before this, just before the seminar, now we did the injection again. This is how it looks now. It is not healed, of course. The metastasis is still in the bone L5, and it is still some spots on the lung after. Well, she was stage 4B, and she comes since more than 4 years to us. And the PET scan nearly no more shows up and is absolutely stable. So we have many of these cases, and especially these hopeless cases. They are not hopeless because we do a totally different approach. Now, I know this is the next case, extremely bad case. Well, super horrible case. Look at this lady. You know, we get such patients to our clinic, you can't believe. Not only, of course, we like much more the beginning kind of cancer. Oh, I was diagnosed with breast cancer or with pancreas cancer or with lung cancer. Can you do something? I want to be biologically treated. Oh, thank you. Come to us, because we do not need orthodox treatment, but we do not say orthodox treatment is not good. So what we do, look at this case. This lady came through America from Sweden to us. So you see how she went to another clinic from Sweden to America, and there I met her, and I had to tell her, you have to come to Switzerland because we have much more possibilities. This was the situation. She had hemoglobin of 7. She was totally cachectic. But this lady, we have this kind of patients, she said, I do not do orthodox treatment. They told me, I have to operate, I have to chemo, I have to do radiation, and probably will still die in 2 to 3 years. you should never say something like this. Okay, she said, then I go my way. And she went biological. And it was stabilized, but well, stabilization on such a case is of course very difficult. Look on the right, we have dark field. When you come to my biohacking congress participation in Bali, end of February of the Society of Functional Medicine, please come. I will take my dark field microscope and I will show you. You see these kind of horrible, I take a drop of blood from the ear to test, and we see these kind of things. It looks like the tumor. Well, but it's one drop of blood from the ear. So this means there must be a milieu thing. Cancer is never only a localized thing. Cancer is a metabolic disease, and you have to act on the metabolism, not only on the cancer. So we did 2 times per day. She was with us 3 weeks. She went back to Sweden. She came back after 2 months, again 3 weeks, 3 times. And we did daily ozone injection. I injected after convincing her and after building her whole body a little bit up. I convinced her that we could do a local, now comes a very important thing, the local chemotherapy. I don't treat the patient with a systemic chemotherapy. She would be, let's say, 50 kilograms of body weight because she was cachectic. She lost at least 20 kilograms. So if I treat her now with a chemotherapy, then, well, does she survive this? Honestly, no, we do a beginning local treatment. Let's say this tumor has a weight of 2 kilograms. Well, then I need 1/50th of the doses and I inject locally. So this is what we do. And we do ozone treatment systemically. Ozone also is magic, especially in the combination with Papini. Now, next slide. This was after 2 days. You see this and this. No more bleeding. Slowly, anemia comes up. We gave her 1 transfusion. We can do all these orthodox things in our clinic. We are extremely well equipped. Well, we don't do the transfusions in the clinic. There is a transfusion hospital where we can send the patient, just outpatient, and they get the transfusion. So that's what we did 1 time. Now it's already better. The tumor mass was reduced to about half of the size. And well, not only that this came post-COVID vaccination, and it was exploding cancer, which we see very much. Now comes the important thing. She came the first time to us. She came in February of this year. In September of this year, it was like this. So you see, she's not healed. She has no more pain. She is much, much better. It's nearly closed. This was in September. She went back to Sweden and she took our long-term medication, which is all oral. And I found for her finally a doctor who does our cancer infusions, which is selenium, vitamin C, sodium bicarbonate, catalysts of the citric acid cycle, and these kind of things, but no chemotherapy, only what we did locally. And you have to do a detoxification. This patient was extremely highly toxic. She had xenohormones, so-called xenohormones. This means from agricultural toxic load, perfluorooctanic acid, which is breast cancer inducing. It's like glyphosate. She had very high. Who wonders that as long as she has this toxic cancerogenic load, as long as she has this, she can't heal. So it's so important to look parallel of all the treatments. We treat the body and not only the cancer. Of course, we do an intensive, most intensive cancer treatment locally with hyperthermia, with heat treatment, with ozone, with nagalase inhibitors. And this is what we can do. Now here, this is more for the doctors. What are we doing? The peritumoral and directly intratumoral injections with lidocaine so that it anesthetizes. It does not hurt. These injections, they more or less do not hurt. Patients hardly feel it. So we do these injections, and then after several minutes, the lidocaine, local anesthesia, like with the dentist, it works. And then we inject this medication, which is mistletoe, which is a low dose, a 1:100 dilution, 1:100 dilution of fluorouracil, 5-FU, combined with selenium, combined with vitamin D, because vitamin D, it is known nowadays that it has a NK cell activating effect. So we increase the capacity of the immune system, not only locally, but also systemically. These are the things, and we do this every day. It activates the macrophages and the ozone, which we afterwards, when it's anesthetized, we inject with the needle, as you see here. Well, that's another patient, of course. We can also inject in small cancers. Every cancer where you get with the needle, we can do this. If there are internal cancer, we have an ultrasound control. We control by ultrasound, and we inject under the control into the tumor. This even works on pancreas cancer, but there it's super difficult. But superficial cancer work very well, especially breast cancer, prostate cancer work, and all skin cancers. Skin cancer, it is amazing. They formally melt away. Now we do the ozone and the PAP-IMI. Look at the next case. Sorry. This is another case. A patient, she came from Dubai with her 2 sons, and she was living partially in the US. And in the US, she went with her colon cancer over more than 4 years. She went to treatment. The patient came with colon cancer reoccurrence, second local reoccurrence, and metastases into the liver and into the bone, pain, a very cachectic situation. She was in treatment in Texas in one of the most world-known clinics, and they more or less told her, well, we can try again another chemo, because she had several chemos already. And then the son called, oh, I heard of you, Dr. Rao, can you do something? My mother is nearly dying. They told her only several months more living time, go home and make your will, so to say. We get these patients, go home to die patients. Well, it's just horrible. Now, what can I do? We do day 1, even in these cases, toxic evaluation, dental, because we see dental problems all the time in cancer patients. And look at this dental situation. She was in Dubai in cancer treatment. She was in Texas in the best cancer clinic worldwide, at least they believe so. And She was in Bangkok also in a cancer treatment. And look at this dental situation. Nobody even looked at it. You have several broken teeth. You have several granulomas. You have several root canal treatments. The situation is just, sorry to say, horrible. And nobody looked at it. This is so much disturbing, toxically. And she even had mercury fillings still. You can't believe mercury is a toxic load which is cancerogenic. Mercury creates cancer in colon. Mercury can create cancer, breast cancer. So you have to remove mercury. Otherwise, the cancerogenic situation continues and you get into a reoccurrence. Dear lady, look, if you come to us, we treat the causes. We treat your cancer, of course, but we also treat the causes of your cancer. And this is one main cause. And it takes you some time. It takes us about 10 days until we know the exact toxic situation, xenohormones, toxic load, pyrethroids, glyphosate, DDT, heavy metals, all these kind of things. But this we can do. Oh, I can anyway, I can't really eat anymore. Well, we did. Are they crazy in this clinic in Switzerland? Cancer patients go home to die. They remove the teeth. We removed this foci. And even though she was go home to die patient, full of pain, this is what we took out. All putrefied, stinking. It was just super horrible situation. And we cleaned the whole jaw. Well, she needed infusions. We do infusions on these patients so that they get stronger. Number one, what we do is to build up the patient's energy so that they can survive. And look at this. That's another patient.
Dr. Thomas, you have 5
Yes.
more minutes.
Huh?
You have 5 more minutes.
So short. Okay, this is the toxic load which we find. Here we find DDT in this patient, and we do detoxification test, which shows us that cancer patients, they very often have a detoxification deficiency. So we have to detoxify them even more. What we do daily ionization treatment, especially on the bone metastasis. It's amazing. It just stops the activity of the cancer metabolism in the cells. It stops. We find even after 2 weeks of our treatment, nearly always when we do these treatments, ozone and infusions and PAPIMI ionization, we find that the PET scan, they reduce the activity. We do daily these injections, and this is what we do. Cancer, now comes the most important slide. The trick why we are so successful and why we have cancer patients all over the world coming to us is that we do 2-track. We treat the patient all in all. We try to remove the weakness. We try to increase the immune system. And the other thing is now we do a cancer cell approach. Cancer cell, now please 5 more minutes. Cancer cells, they have a different metabolism. On the right side of the slide you see now, they are different, and we attack the patient's cancer cell on exactly this dimension, that they have heat intolerant. When you heat up the cancer, when you heat up cancer cells up to 42 degrees or even 44, they get apoptotic. they get stabilized, they no more grow, they don't tolerate, or they even fall apart. Healthy cells, they support the 44 degrees locally. So, not, of course, not systemic temperature, but local temperature we increase by local hyperthermia. We have a very strong device. It's called INDIBA. Go to internet. INDIBA, INDIBA, INDIBA from Spain. This fantastic device where you can heat up with different electrodes. You can heat up innerly the cancer tissue up to 42, 44. Then they fall apart or they get apoptotic. Now, next is they have a lack of functional mitochondria. Why do they need sugar? Cancer cells, they feed from sugar. They need sugar. And if you take sugar away and short-chain carbohydrates, they are starving. So you can weaken the cancer cells by taking sugar or short-chain carbohydrates away from them. So that's why we do the diet very intensively. Now, cancer cells, they have a low cell membrane potential. They have 20 to 40 millivolt from inside to outside. This is now scientifically proven by this lab in Leipzig in Germany. They finally could really measure the cellular load. Professor Brigitte König, she's this pope of this measurement, and we can measure this. Now, that's why they need and they can take up sugar by diffusion. So it's following a gradient, an osmotic gradient. This is how the sugar comes in because they have such a low membrane potential. Healthy cells, they need oxygen. And oxygen only goes in if you have a high cellular load. But cancer cells, that's a big difference. They are destroyed. The cancer walls, which are anyway different, they are disturbed or hurt by oxygen. So we give ozone treatment. Ozone, multi-pass high-dose ozone, we give on these patients. It helps the healthy cell, but it damages the cell wall of the cancer cell. So these are the three things which we do. Heat, mitochondrial treatment, and PABIMI, which loads up the cellular load. And this is what we do. And we do this every day. And we put the patient into a less active cancerous situation. When they go home, they continue with our remedies. And the last thing up on this slide down is the CGNF, which is the nagalase inhibitor. Because, and that's now modern immunology, our treatment is extremely based on modern immunology. Nagalase inhibitor. I know time is off. This is a very important slide. If you want more, please either come to the Congress in Bali or contact me. Please contact me www.biomed-int.com. Dr. Rao, thank you very, very much for listening.
Thank you, Dr. Thomas. The information you've shared is really, really important. And we have a lot of questions in the chat. So I'll take one or two questions.
Yes.
Okay. So, 1 second. Yeah. So does hyperthermia or infrared radiation induce angiogenesis to the tumor site?
That's a very good professional question. The answer is yes. We increase with the No, you have to address from a different side. The antigenicity gets changed and it gets realized. You know, the perception of the antigenicity changes. The cells, this comes from the nagalase inhibitor, which we give. We have this, the first worldwide oral nagalase inhibitor we can give, and this reduces the nagalase. And nagalase is this protecting film around the cancer cell, which makes that the perception of the macrophages is no more there. They no more realize the antigenicity because the nagalase is like a mantle around the cancer cell and decreases the antigenicity. And by taking this nagalase away and activating the white blood cells function, is hyperthermia. That's why we give the whole body hyperthermia also, fever treatment. Then the white blood cells, they get more active, the macrophages, and they attack the cancer cells. We can measure this. You can measure the macrophage activity. We can measure the cytokines. We can measure the T cells. We do this all. The background is how do we change the environment of the cancer and to increase the cancer antigenicity perception.
Okay. So one more question. So what would be an average cost for cancer treatment at your center?
Yeah, this is a good question I'm getting asked every day. It depends a little bit. The first day is a little bit on the expensive side. We have the whole 1 week is around $6,000 to $8,000 US dollar. Well, we have Swiss francs, but I tell you in dollar, which is more or less aroundish 6,000 to 8,000 francs. But there is these metabolic tests are included. Next is the after weeks is around 5,000 to 6,000 per week, but it includes everything.
Okay, all right. Great. Thank you so much, Dr. Thomas, and thank you for being a part of the IFM conference.
I thank you that you let me be part of this. Thank you very much. It's really an honor.
Thank you so much.